Okay, now let's move into next illness, chronic kidney failure. So kidney failure is the illness still caused by some other illness, like a patient have some other illness and affected kidney functions, then may cause the kidney failure. So that's for later stage or ending stage of the kidney problem. Still a long term, yes, still long term, gradually development. So truly kidney failure can develop from the illness we just talking about before. And that's the mainly reason cause the kidney failure. So that means kidney severe damage and totally losing their function. When we're talking about kidney failure, kidney totally losing its function. So these kind of patients, yeah, they are very, very severe sick, even more severe compared with the last illness. So that's basically, yeah, basically these kind of patients, if we go to test their body blood test, like the toxin level is pretty high. So the symptoms of the kidney failure, yeah, chronic kidney failure. So from the beginning, maybe patients don't have special kind of symptoms. Maybe just generally weaker, fatigue, generally less fuel, and even patient after pretty good sleep, people still feel tired, and maybe some people difficult feel sleep. And another symptom, skin dry and itchy because some toxins couldn't relieve from the urine. Then they will try to relieve from the skin and cause the skin itchy and dry. And also can cause lot of other symptoms like some muscle twitching, some muscle twitching, or maybe cramping, or maybe convulsion, especially worse at night. And also like a poor appetite, nausea, vomiting, stomach painful kind of situation, and some like a tasty smell in the mouth. So that's generally safe. That's generally safe. And also possible severe kind of case with a hypertension or maybe bleeding, or different kind of bleeding disorders. So that's generally symptoms about kidney failure. What's the medicine diagnosis? So basically, patient have a lot of symptoms already. Then go to laboratory test and truly with the blood test in the blood serum. We especially have ingredients in there. They are pretty high. So basically, normally, it's relieved by the kidney. now kidney is failure. So that's their amount is much higher in blood circulation. So basically that can give us some suggestions or diagnosis. And certainly sometimes we especially take a sample coming from the kidney and then like looking under the microscope, we can find the structure of the kidney is changing. So that's sometimes we make diagnosis. And sometimes ultrasound can make a diagnosis also. We can see some fibrous changing inside the kidney. So Western medicine have lots of ways with diagnosis. And these kind of patients also maybe cause other problems like anemia and also some severe kind of case, patient maybe even coma with helpless. So treatment for kidney failure. So that's we say we still mainly treat originally the problems of illness. So like this illness still mainly the ending stage caused by other illness. So our mainly treatment still treat originally illness. Like people have diabetes, we still treat diabetes. Patient have hypertension, we still treat hypertension. So that's mainly we still treat. And another aspect, we're talking about the kidney losing functions, and then they may not able to release some toxins. So in that kind of situation, like a pretty severe kind of situation, the patient need to go to like a hospital, use a special kind of machine. So these kind of machine, they working like the function of the kidney. So basically, we got some connections, like a patient lay down there or even sometimes sitting there. And then we take the patient's blood, that may be the hand here. So we take patient's blood, put it to the machine, and then sending the blood back to the patient. But this machine working like the kidney functions, filter functions, can clear the blood. So this kind of treatment pretty popular for chronic kidney failure kind of patients. By this kind of treatment, basically need like once a week or even sometimes twice a week or 3 times a week. So regularly clear some toxins from blood circulation. So that's routine kind of treatment. And certainly, if patient's kidney truly not working, and thinking about the transplant for the kidney, but the transplant is still complicated process, need matching for the type. So we're talking about people have 2 kidneys. Everybody have 2 kidneys. People can live with only 1 kidney, but couldn't live without kidney. So thus, kidney transplant is possible from like family members or friend or some people special donate for the kidney. You can marking for the patient's kidney type. Then transplant the give patient one kidney and the people living with one kidney. That's possible. So that's for truly some people couldn't recover their kidney function, severe kind of case. Then we still go back to TCM. So TCM for this illness, we call 关格. 关格 both means close, yeah, no urination, yeah, severe kind of patients. Patient no urination, it's some blocking there, yeah, blocking. So that's basically. And certainly, if patient have some other symptoms more severe, we still postpone other names. So the pattern, yeah, pattern. So basically, this illness, all the pattern is severe kind of pattern. It's kind of deficiency combination, maybe with excessive. So Qi and yin deficiency pattern. So we have Qi deficiency symptoms like people fatigue, weaker, short breath, don't like moving, or people sometimes people just lay down on the bed for a whole day, or maybe just sitting there for a whole day. Pretty weak, yeah. And the lower back and the knee weakness, don't want to eat, and also dry mouth, dry throat, but don't like drink too much water because at the same time they also have water retention. And some urine taste in the mouth. That's because their urination amount very decreased, only small amount from the urine. The toxins try to release from the skin, from the mouth. So that's some urine taste in the mouth. And scanty, yes, scanty yellow urination. Small amount, yes, small amount. That's mainly in the daytime, but possible in the nighttime, some clear urination. Kind of in deficiency kind of patient, usually have night urination. And 5 center heat in deficiency. The tongue color truly depending is more in deficiency, more T deficiency. More T deficiency, pale color, more in deficiency, red color. Teeth mark, that's water retention. Generally say weaker pulse. So for the book, they still give patient formula. But for these kind of patients, yeah, like a treatment principle, we still say tonified tea and nourishing in. So tonified tea will mainly tonify the spleen, nourishing in will mainly working for the kidney. The formula we use 参其地黄汤 modify. 参 still we still can use 太子参 momander and 其黄芪地黄汤 similar like we talked about the 地黄丸 before. It's toxins. So that's kidney tonified. But for these kind of patients, we talked about before. If we use the herbs, we need to double check ingredients. No toxic herb will toxic for the kidney. That's the most important part. And then we can cooking the herbs like a little bit longer. So usually we talk about we put the herbs on the pot and about 1 water over the herbs, soak it, and then boil it. So usually other patients they may leave in about 1 cup of the decoctions here, the herbs in here, and then drink it. These kind of patients, we try to cook it a little bit longer, like just a half cup of the the herbs here, like patient to drink it, because the patient couldn't handle too much water. So we got a little bit high degree kind of decoctions for these kind of patients. Acupuncture generally is the most safety way compared with the herb treat for these kind of patients. So we say backroom of the kidney, backroom of the spleen, and the stomach 36 generally T blood 25, and the kidney 7, kidney yang 25. Marks are still depending. If not too much heat, we still can use marks because that's different. Next part, we're talking about indifference, both kidney and the liver indifference. So still body weaker. We're talking about this illness. It's like an ending stage of the other illness. So body still weaker. People still possible lay down on the bed for a whole day. And indifference even more damage body fluid, cause dry skin, bitter taste in the mouth, and dries out dry mouth. So thirsty, don't want to drink too much. They try to drink some cold water. And the patient still kind of like a urine kind of smell in the mouth. Still, their urine amount too less, couldn't relieve enough like toxins. And the self-centered heat, that's indicates patient insomnia, difficult fell asleep or maybe dreams, and the lower back and the knee sore, that's coming from the kidney, and the stool is dry, yeah, dry stool, and the scanty yellow urination or maybe even red urination, depending what kind of originally in there. Maybe damage the kidney functions, maybe some blood in the urine also. And also possible patient maybe headache, dizziness, tinnitus, and irritability, emotions, so maybe a lot of symptoms. And the tongue, yeah, the tongue still depending. So maybe mostly right tongue, yeah, mostly right tongue. Scantier tongue coating or no tongue coating, or maybe little bit thin yellow coating. And weaker pulse, yeah, thin, weaker pulse. So treatment pencil with nourishing liver and kidney. So basically our treatment pencil just matching our pattern. So our pattern here, liver kidney deficiency. So that's the commonly used words nursing. If you say tonify liver and kidney, still okay, still okay. Even the book they translate may be different, but mostly for indifferency we use nursing. Look like moisture. Yeah. The formula we use 知柏地黄丸。地黄丸 that's the herb tonified kidney. 知柏，知 is 栀子，柏 is 黄柏，栀子 clear heat from 3 gel. 黄柏 mainly clear heat for lower gel. So that's the kidney nourishing herb plus 2 herbs clear heat, clear deficiency heat. And acupuncture. Yeah. So basically, this kind of patient, I don't suggest you to do massage because some heat inside. Yeah, heat inside. If you try to use massage tonify, we're still talking about use lower part of body, maybe kidney 1 is better one. And even kidney 3 still good. Yeah, south point of the kidney. Spectrum of the kidney and the bladder 64, that bladder channel, and the bladder 18, that's the liver, bacterial liver, and the kidney 7 is kidney young. You can add in more by the patient's condition. So that's generally for this pattern. Then the pattern we're talking about spleen kidney T deficiency, post deficiency. So T deficiency, people tired. They even don't want to talk, they don't want to eat, and abdominal distension, or maybe losing food. And a sticky kind of feeling in the mouth. They may not thirsty, maybe thirsty, but don't want to drink water because deficiency inside plus some water retention. And the patient lower back knee sore and painful. That's the kidney control part. And usually people is cold feeling, not warm, yeah, not warm. And night urination, more urine in the night because kidney T couldn't hold it. And heel tongue is marked and deeper weaker pulse. So that's for the pattern. And the treatment pencil will tonify the spleen and tonify the kidney. So the formula we use 保元汤 modify 加味 plus 元 here is originally T or 元 T. 保 is protective. So patient have severe cardiac disorder. It's 元气 severe damage. So we mainly protecting of 元气 and modify from there. So you still can check in for ingredients from the book. Acupuncture. Acupuncture points spectrum of the kidney and 三阴交 6, 3 meridian meeting. Yeah. Sign 3. Intel is meeting, cross or meeting. And Renal, we say that's still 元气, yuan qi located I, we still codify and nurture. And spin 9, 阴陵泉, review afterward. So this one, we can think about the muscle. We can think about muscle. All the points generally say we can muscle. So that's 闷累气 deficiency part. Yang deficiency part. Still spleen kidney. So what's the difference? We say yang including qi part. Yang including qi part. Patient have qi deficiency symptoms and also cold feeling. Severe kind of cold feeling. Then we say that's yang deficiency. So you can see like a patient still have qi deficiency symptoms, like we talked about before. And then plus chilled pain in the lumbar area, or maybe feel cold on the terminal. And the patient still possible edema. And still frequently night urination. Possible clear, but scanty. And pale color on the tongue. And with this mark. Yang deficiency even causes severe kind of water retention. So that his mark is the symptoms and the signs water retention. But it is mainly caused by yang deficiency. Deeper, weaker pulse. Treatment principle. Truly we need warming. Yang deficiency we need warming. And tonify spleen and kidney. So this formula we use 真武汤 plus 真武汤 mainly formula codified kidney yang. But spleen yang and kidney yang they are pretty commonly relationship. Certainly we can add in more herbs for the spleen. Acupuncture and massage. So truly marks are pretty important for this kind of pattern. Warming, moving. Marks are more warming compared with acupuncture. So truly is very important for this pattern. The points basically we still go to back of the kidney and the 3 in points, meeting points, 6. And yuan points, 关元, 延寿, and spleen 9, relieve actual water or edema. Then another pattern, even more severe kind of case. Thus, we talking about yin and yang both different. So patient very weak, and feel cold because yang deficiency. But they also have some heat, biocenter heat. because they're indefinite. And the dry mouth, they try to drink, but couldn't drink too much because deficiency and still tasty kind of urine in the mouth. We talked about this is severe kind of kidney disorder. Kidney totally losing functions, couldn't release toxins from the urine. So that kind of toxins go to skin, go to mouth, even sometimes go to large intestine, try to relieve from it. And the lower back knee sore, that's basically kidney deficiency signs. And don't want to eat, poor appetite. And losing stool, that's spleen deficiency signs. Yellow red urine, or maybe dry stool, that's indefinite signs. Clear urine, that's young deficiency signs. So all the patterns mixed together make this more severe, complicated pattern here. Tongue may be pale, may be red, depending if more severe yang deficiency or maybe yin deficiency. So usually it's swollen tongue with this mark because water retention is deeper simple or maybe deeper weaker pulse. So treatment principle for this certainly we need tonify or nourishing both yin and yang. The formula we still use 金匮肾气丸 that's mainly yin yang tonify formula. But truly in this formula it coming from 六味地黄丸. 六味地黄丸 is kidney yin tonify formula. So that's mainly we're working for the kidney and plus other herbs. Acupuncture treatment. So if more yang deficiency, we still use oxa. If more yin deficiency, but not too strong heat size there, because patient have both yin yang deficiency, heat size usually not that strong. You still can use mask. The points, we still use pretty similar points. Factor of the kidney, speed 6, kidney 7, and kidney 3. Kidney 3 is Yuan south point of the kidney. Certainly you can adding more points like bladder 20 to 4, then 4, more nourishing, more 25 points. You can add in. So that's for this pattern. Yeah, that's for this pattern. So these illness, yeah, these illness. So truly, we're talking about it's pretty chronic, yeah, pretty chronic, and a pretty later stage of the illness. Especially this illness, pretty possible coming from last illness, talking about chronic kidney infection in there. So truly, we try to avoid some herbs. They truly have toxins, like we talked about before. So both these two illnesses belong to kidney, severe kind of damage kind of illness. We try to not use like toxic herbs for treat these illnesses. And certainly, these two illnesses will even try use nice terms compared with the acupuncture. So truly, acupuncture may be even more safety, maybe even more safety for treat this kidney disorder. But some herbs we still use. Be careful not only use one formula for long term. Uh, if they are not truly effective, we try to change in another formula to relieve some toxins. So that's basically. And also these illness we always talk about ending stage of the kidney disorder. So they make combination with yang deficiency, yin deficiency, stagnation of the heat, and even sometimes blood stasis. So basically, if patient combination with some like stagnation and kind of heat inside, or maybe blood stasis, that kind of condition is very dangerous situation. So basically, I don't think you will see a lot of patients in our acupuncture clinic for this illness. But truly, if we're meeting this kind of patient, still thinking about we still can help. We couldn't say we totally cure it, but still can give some kind of help for this patient.